and accelerating actually delivery of innovation to our customers and to the healthcare space. I therefore feel very privileged and honored to host today's LinkedIn live session. For this panel discussion, I have 3 representatives from smaller companies who have actually joined our Roche digital ecosystem and who are happy to share their experiences with us today. And they are?
Hi, I'm Rinat Gutman. I'm the VP Product at Medial Earlysign.
Hi, my name is Tero-Pekka Alastalo. I'm the head of the North America operation and the president of CardioSignal, based here in San Francisco Bay.
Kenny Lienhardt, I'm the co-owner and CTO of Medignition. Pleased to be here.
Yeah, so I already mentioned collaboration, and actually a first step towards collaboration is sharing. So a big thanks to the 3 of you for coming online today and taking part in this panel discussion to share your knowledge and your experience and to provide our viewers with answers if they have questions. That brings me to a few housekeeping rules first. So we will have a Q&A session after our discussion. So please, viewers, you can put in your questions into the link provided, and we will try and cover as many questions as we can. Those we can't, we will come back with answers to you after this session. Also, as a final point, please note that no questions will be addressed pertaining to specific treatments or products or solutions or any personal medical questions. So without further ado, let's get into it. So, dear panelists and colleagues on our ecosystem, please briefly introduce yourself and your company and just give us an idea, how you came on the Roche ecosystem and what was your motivation to do so. Can we start with you, Rinat?
Of course. So thank you, Michael, and I'm happy to be here. Thanks for hosting me. My name is Rinat Gutman, and I'm a VP Product and leading strategic partnerships such as Roche at Medial Earlysign. And I've been working in the healthcare industry for the past 15 years. So I've been around. Medial Earlysign is developing AI clinical algorithms to high-risk burden disease such as colon cancer, lung cancer, and other malignancies, diabetes and other. And what we actually do is we flag or we mark patients that are at high risk for complication or harboring those diseases that I've mentioned. And we are here in an effort to help improve care. We are working with global healthcare organizations such as Roche to, again, prevent early detection, prevention, move towards prevention healthcare. And we've been around since 2009, so we have some experience already, quite a large evidence base was built, publication that were published. And we started our journey with Roche in 2018. And I think we'll elaborate a bit more later, but the reason that we partner with them is due to their vast outreach and their market share and the ability to partner with professional healthcare organizations in the hoping of bringing our solution to more patients, to more healthcare provider, and helping bringing specific insight, predictive insight, personalized to patients in the hope of making healthcare system better.
Thank you, Rinat.
Thank you.
I mean, your collaboration, your company, with Roche goes back quite a long way, even in a field as new as your one. How about you, TP? Can you describe your involvement in the Roche ecosystem?
Yes, and thank you for the invitation for this panel discussion today. Yeah, so we've been working on a novel concept of digital biomarkers for heart diseases. This is a result of over 10 years of academic research already. So the technology has really been on the development for a long time, and now has been also tested in real life patients with over 200,000 of those. And so we're really kind of working on a concept of software as a medical device, and we can operate this in any handheld device, whether it's a smartphone or hospital use devices such as Copas pulse, really enabling a very rapid, scalable, accessible and affordable strategy for detecting heart diseases and monitoring heart disease patients. Extremely easy to use. You put the device on the chest for 60 seconds and that's all. And I think this is really enabling kind of a novel scenarios for digital ecosystems in looking for heart diseases and boosting early detection of diseases. And I think Roche collaboration for us has been, of course, I would say a success story. We really believe that our technology can really benefit digital ecosystems, and digital ecosystems can benefit our technology. And in the end, most importantly, it will benefit the patients and the people who are working with patients. And so far, I would say this has been, of course, very exciting collaboration. It has already given us opportunities to open doors in health systems and really boost the education and the awareness of our technology in mainstream healthcare, where we really want to see this technology landing soon.
Yeah, thanks, DP. Of course, it's very novel technology, and you're using basically the newest sensor technology and AI behind that for your solution. Kenny, you've gone a different path with your company. It's purely digital based in the area of retinal disease management. Could you describe your path joining our ecosystem?
Yeah, sure. Thanks a lot, Mike. So my journey actually starts at Medignition, and Medignition is a company builder in digital health and the parent company of ventures such as Oculocare and Augenmobil. They're mainly related to telemedicine and mobile health. Personally, at Medignition, I oversee the design and engineering team and set technical vision for the company and its subsidiaries. We have joined the Roche ecosystem at the beginning of this year with one of our ventures. And as you've already mentioned, Mike, this venture company is providing a digital solution for the early detection of retinal diseases. Partnering with Roche has the advantage for us that Roche has a very deep understanding of local markets that we as a new company would need to build from scratch for every country. So since we share Roche's vision when it comes to digital health, and we also have aligned business goals, of course, this then gives us a boost in marketing our product. And I think from this ecosystem approach, doctors also benefit, since they have a trusted platform via which they can access digital solutions, and they know that these solutions have been assessed when it comes to important aspects such as data security, clinical research, or regulatory.
Thank you, Kenny. Listening to that on a personal note, my own mom, actually, she went practically blind due to undetected retinal disease. And, I only wish that she had access to our ecosystem and our offering with your solution. It may have helped her to prevent that blindness in the end. But it's actually fascinating that the three of you, you have different innovative technologies, and you're helping patients in different disease areas, and still you all decided to join a digital ecosystem, in this case, the Roche digital ecosystem. So, from your perspective, why should such innovative companies think about joining such a digital ecosystem instead of, for example, going it alone or going into some sort of acquisition deal? Can I go back to you, Reina, to start us off with that one?
Of course. I think as a startup, most startups are lean organizations that constantly have to prioritize. And I look at the partnership with Roche as an amplifier. It allows us to extend our reach. And, usually as a lean organization, you have to pick and choose. Which region are you going first? Is it the US? Is it the EU? Is it APAC? Which countries? And you really have to be very strategic about it. With partnering with Roche, we can sort of go all in. So with their feet on the ground and global outreach, we can enhance our reach. And I think it also allows us to focus on what we do best, which is developing AI tools and algorithms, and then, adding more solution to our portfolio, and then using this existing platform also to new and existing customer and offering new solutions. So it also allows us to focus on what we do best, which I think is always good.
Yeah, I actually fully agree with Rinat. It takes it's a long and rocky road to take novel technologies into mainstream healthcare and really create, I would say, successful, commercial scenarios for the new technology. I fully believe that an ecosystem solution in the world of digital health will be the way to go. As Rinat already said, it really opens a lot of doors, increases credibility, I would say, for the novel technology, and really increases the outreach of capabilities to really introduce the technology, start piloting and training and educating customers around it. And I think it also helps probably also quite much on the so-called user experience. If this technology is integrated into a digital ecosystem, it's probably easier for the users and end users to adapt into using it and to really streamline the use of this technology. If you compare to a scenario where our technology is a standalone strategy in the system, so I think the ecosystem model is I would say it will be the end game model in our health systems and in the healthcare organizations when it comes to digital health solutions.
Yeah, yes, TP. I mean, we've heard from you that our industry is not known for its speed of adopting innovation, and that is quite true. Kenny, how do you think an ecosystem approach can help us here?
That's a good question, Mike. So I think my thoughts are fully in line also with Rinat and TP, and so I will try to answer the question rather from a theoretical perspective. And there I think that the ambidexterity concept describes really well what the possibilities of an ecosystem are. Ambidexterity is typically defined to use both your right and your left hand equally well. So in a business context, this basically means that you're equally good in exploring and in exploiting. So when it comes to the providers of large ecosystems, these are typically big global companies, and they are good in exploiting. Exploiting meaning they are good in executing well-defined processes and to improve these processes over time via incremental innovations. We as startup companies, on the other hand, we are very good in exploring, that is to say, the ability to build disruptive innovations. So providing disruptive innovations via a digital ecosystem is a very good example of ambidexterity, bringing together both worlds, the one of exploring what we do in startup companies and the one for exploiting, that means scaling products and providing larger ecosystem, and this is something that Roche can provide.
Thanks, Kenny. Well, that's really sounds like bringing the best of both worlds really together. And of course, the three of you've all brought very good reasons for joining such an ecosystem. But what is it? What checkboxes would need to be ticked from your perspective to declare such an ecosystem collaboration as successful? TP, you already mentioned the slow adoption rate, of innovation in our industry. So, TP, how can we measure success in the short term? Because long term, yes, we may have huge advantages, but how can we measure success in the short term?
Yeah, that is definitely, I would say, a wide spectrum question. If I look at it from I would say, a startup leader perspective, of course, the ecosystem has to have certain qualities when it comes to privacy and regulatory approvals and safety, etc. But I think I would consider that those are, of course, I would say, almost trivial things when you think about doing anything successfully in healthcare. So, but also I really look at this from the perspective that how can we actually measure, I would say, success for our technology as being part of the ecosystem? And I really start looking at that from the perspective that how much are we really starting to see adaptation for the technology? So, of course, I think there has to be a good partnership between the ecosystem and us so that we have these opportunities to educate the healthcare organizations about the technology, also capabilities to listen to the healthcare organizations of their needs and the problems that we're trying to solve here. So it's really how well can we bring this technology into the hands of these healthcare organizations through the ecosystem, and I think that's where we need a partnership that is really collaborative. And because in the end, we're measuring it through the adaptation. Are we getting those opportunities to pilot and test the technology with the healthcare organizations that are using the ecosystem? And eventually, hopefully, even showing data that it's really helping a major problem inside the health system that will lead to a commercial, I would say, success for the technology. So, of course, as a startup leader, I would say those are all factors that I would consider as critical when I look into the future of the partnership and being part of an ecosystem.
So I guess another way of showing short-term success is that there is a mutual gain actually from such a partnership in the ecosystem. So
definitely, yeah.
Kenny, where do you see mutual gains?
Yeah, when I was thinking about this question, there were two aspects that came to my mind. The first one being trust. And I think trust is important because the ecosystem must be a reliable source for digital health solutions. As TP just highlighted, there are certain criteria, they are a must, right? And they are a must because otherwise healthcare providers, they will not trust in these solutions. And I think one key aspect there that we really have to get right, and that is maybe a bit more difficult than regulatory data security and so on, is user experience. I think something TP also highlighted. So the digital solutions, on the other hand, that are then part of such a trusted platform, they must pass formal assessments. And I think this is a bit a problem when we look into today's public app stores, may that be the one from Apple or Google, because basically there everyone can publish an app and it's not so clear if they passed the formal criteria such as clinical research, data privacy, and so on. And this is also a problem for the digital solutions that actually publish their app in public app stores and that passed all these assessments. There is not really a difference between the solutions that passed the assessments and the ones who did not. And then a second aspect I would highlight is the one of the business model. So large companies such as Roche, they typically have existing revenue streams, and creating a new ecosystem will probably not be a cash cow from day one on. And so a company like Roche needs a long-term perspective when it comes to the ecosystem, and then also how to earn money with it. If this is a short-term thing, then it will be tough, right? It will be tough for Roche to earn money, but it will also be tough for the startup company, because then you always get the impression that this is rather a hobby and the large company tries something, but you're not so sure if it's serious. And that's what was also the reason why I highlighted in my initial answer to this webinar that it's really important that we as Medignition share the vision of Roche, and we know that we work towards the same goals.
Yeah, that's right, Kenny. And Another advantage, of course, is exactly that with such an ecosystem, we have the opportunity of bringing, our customers, our medical professionals together with such innovative startup companies to explain and actually pilot and co-create solutions for the customer's benefit and ultimately the patient's benefit. So these improvements, I think, can also be measured as outcomes in the short term as improvements as well. So yeah, in an ideal world, we would be very quick and we would easily reap the benefits of such an ecosystem play. But unfortunately, we don't live in an ideal world, whatever that may look like. So the next question is, from your perspective, what are the biggest roadblocks, you have seen or see when creating a successful digital ecosystem and creating this win-win scenario? Rinat, you have been successful. You are successful. Was it easy to get there where you are today?
I feel it's a trick question, but I'll take the bait. Well, I think like every partnership, it's a culture shift. So if you mentioned before doing it alone, so it's shift from, doing it alone as a lean, small group of people, startup, had an idea around very fast to operating together. From being fast, maybe agile, to have more stakeholders, more opinions, more ideas, sometimes longer processes. Things take a bit more time. And I think Kenny mentioned that Roche think and act long-term, like 10 years ahead. And as a startup, you plan ahead, you think long-term, but you must act on short-term. And I think the key is bridging those differences and be aware of each partner needs, discuss it. So there's a difference, but you can easily bridge them by understanding and accommodate the different needs.
Yeah, I fully agree with you, Rinat. And I think this culture thing is probably the biggest challenge, right? So I'll try to answer the question from a different angle, taking the one from a designer of a digital health product. And I think there it's tough to create a single product that you can then distribute globally. So I think, and this is also our experience, that you need to adapt the product to local market. And there the question is, how do you do this? How do you use a global ecosystem while still having the possibility to adapt your product to local markets and the local needs? Because there we've experienced that some features, they might be very important and key in your web app or in your mobile app in some countries, while in other countries, you simply have to remove them because they are not important at all. And how do you handle this? How do you handle this in terms of storytelling and marketing? But then also, how do you handle it from a software architecture perspective or from a UI design perspective? Because I think one of our main learnings there is really that you cannot build a one-size-fits-all tool, because then at the end, it probably will fit simply no one.
Yeah, okay. It sort of sounds like, build for global, but deliver local. I think that's probably one of the biggest challenges as well, is bringing these innovative solutions into the customer or the clinician's workflow. Because if it's not seamless, then, such professionals do not have the capacity, not even the mental capacity to work with multiple solutions across multiple UIs. It needs to be integrated. And I think that's where having, an integrated ecosystem approach can really benefit here to provide an integrated solution for these clinicians. These are all sizable challenges you've mentioned. So based on your experience, what advice would you give to innovators to overcome these challenges?
Yeah, I think in the world of digital health, the list of challenges is an enormous. If you think about taking any technology into mainstream healthcare, I always think that some of the biggest challenges for innovators like us to get a new technology adapted, whether it's a freestanding technology or part of the ecosystem, is technically lack of data or you don't have enough data. It's demonstrating your technology works, it's safe, and it can really solve a problem. And you can really demonstrate for the healthcare organization that this creates, I would say, often a major financial benefit, whether it's process development, outcome improvements, or some kind of a reimbursement strategy. Of course, those are things that we are constantly thinking about. Those are those challenges we are constantly fighting against. But of course, I would say, I think it's very important, especially when you are integrating your technology as part of the ecosystem, is also that you listen to the customer as much as possible, so that you really understand how to tweak your technology and how to tweak that approach that you're trying to sell to the customer, so that it really fits into those workflows. And of course, different markets are different. A market in a hospital system in the United States might be working quite differently to a health system in a European setting. So there are certain differences, but and of course you have to understand those. So, but I think it's really data. It's really listening to the customers and understanding that you are really solving a problem, and especially as part of the ecosystem, you're really creating a user experience and a product and service that really fits the workflows and solves a major problem.
Yeah, and providing facts that you are actually solving that major problem is definitely valuable. Rinat, what advice would you give?
I think it's, I'm going to say communication and transparency. And I think if we talked before about, partner or a culture shift, it's about building a new culture together. And I think a lot of the time that I invested from the beginning of our partnership with Roche is really asking, have everything on the table. So we're discussing everything, sometimes rethinking together, sometimes asking the same questions, a lot of patience on both sides. And I think it also has to do with clear roles and responsibilities, while leaning on the strengths that each partners bring. So you can keep your strengths. For example, we're being, lean, agile, Roche need to stand in the highest standards and divide the work and create a partnership in a way that would leverage those advantages. And I think what we also learned, again, as Roche has to stand to the highest standards, is that if we build the infrastructure for publication, evidence-based, our QMS system, so if we have everything in place, so it speed up things and it also build confidence. So I think this was very important.
Okay, and continuing on that note, how has our collaboration helped you?
So if we mentioned before that you have much more stakeholders involved, it's also an advantage. So, we're used to sit in the same room, take decision. Now you have sort of second opinion or second eye of people who are professional, obviously. So you get another opinion from the outside looking with you, which is great. And I think the other very big advantage, which we also talked about a bit earlier. So again, as a small startup, you usually work bottom up. So you go from door to door, from healthcare to healthcare. You're trying to convince them that your solution is the best. Having Roche with its, sort of market spread, market access, and having access to key opinion leaders on national level help us to go top bottom and setting guidelines and setting standards. And so I think this is really, again, the access to the market, and not having to choose whether I go regional, you can go full-blown national. Having this expert opinion was very useful for us.
Okay, so I mean, pairing that up, with Roche, with the advantages and the reaches you mentioned, pairing up with your agility, let's say, as a startup,